Our bright idea is a urology rapid access unit. We launched it 18 months ago with the aim of taking the winter pressures away from A&E for urology patients. The benefits of UROW is that patients are seen immediately by a urology nurse practitioner, and the average turnaround time from arrival to discharge following treatment is around about 2 hours.
So the team on ANEC ward have changed the ethos to focus on recovery and discharge. This has helped to solve the problem of lengths of stay of our patient population, and it has helped to increase discharge rates, reduce readmission rates and reduce length of stay.
The bright idea was that we were going to reduce the incidence of pneumonia after major emergency surgery, and that's because we knew that getting a pneumonia greatly increased people's chance of mortality with the operation. The other things that we were hoping to make an impact were the hospital stay, the amount of time people had to spend in an intensive care unit, whether they would have to go back to the intensive care unit, and hopefully getting them back to normal function a bit quicker than previously.
My bright idea is the REFLECT programme. The REFLECT programme came about because of delayed transfers of care for long-term service users from secondary to primary care. What the REFLECT programme added was coping strategies and mechanisms to improve their quality of life pre and post-discharge.
Our bright idea is to develop a MACMILLAN end-of-life coordinator role that will oversee end-of-life care for patients who are in an acute hospital, and looking forward how that might develop into something that will improve care across our organisation, but the greater NHS as well.
Our bright idea is to create an MRI activity book for children. We're wanting to make it interactive and fun for children to learn about MRI before they arrive in our department, because MRI is quite a scary place, and we're trying to make it as interactive and fun so that children feel at ease and have a bit of an understanding before they arrive with us.
Our bright idea was to develop the self-teaching programme for patients or relatives to administer subcutaneous chemotherapy in their own home environment. This was to reduce the patient's need to travel to the hospital to have the chemotherapy administered, which could sometimes incur lengthy waitings in the haematology day units and the ward environment.